Hi, Dr. Corey here, and thank you so much, and I appreciate you following through and trying to learn more with our Thyroid Recovery Success Secrets. Today we're going to talk about blood sugar or blood glucose with Success Secret number 11. From a medical standpoint, your normal blood glucose level has a broad range of anywhere from 70 to 105. It's a broad range again. Remember the blood test in the labs that talked about the difference between functional and traditional lab values. Now, with 70 to 105, while the functional or optimal range for blood glucose is actually 85 to 99. 85 to 99 versus 70 to 105. So, according to the American Diabetic Association, a blood glucose level reading of 106 to 126 is actually termed insulin resistance, where anything, or diabetes, or pre-diabetes, anything above that reading is actually 127 is actually your diagnosis of having diabetes. So make sure that we look at the distinction between the two. Pre-diabetes, 106 to 126, anything above 126 is diabetic. So what we want to look at is that with those lab values, granted those are the fasting blood glucose levels, it's important to note because many times I'll see patients in the office and they've gone through and they've had the blood test and I ask them, has this been a fasting blood glucose? And they say no. Well, you need to know that you have to have at least a 12-hour fast, which means absolutely no orange juice, no drinking, no coffee, nothing prior to that 12 hours, only water prior to that blood test that you're going to go to the lab for. Supporting hypothyroidism is futile for your blood sugar levels if they're too high or too low. A reading below 85 would mean that you have hypoglycemia. And a reading above 99 would be termed hyperglycemia, too little or too much sugar in your blood sugar. This is called dysglycemia, both of them. It's dysregulation of your blood glucose. And it's a stepping stone to diabetes. Now, diabetes is becoming so prevalent in the United States that healthcare research is showing that it could even bankrupt the country because of diabetes and how our lifestyles are being managed now and the food intake that we're choosing. So it's super, super important we eat a healthy meal. Hypoglycemia is a condition in which your blood sugar levels repeatedly drop too low in response to the high carbohydrate foods that we eat. Refined sugar is a good example of high carbohydrate food. It can also be a result of going too long without eating, as many people in our society skip breakfast. I urge you, please don't do that. It's important, if your blood glucose is below 85, that you eat at least every 2 to 3 hours, and you should have breakfast, a snack, lunch, a snack, dinner, and a light snack before you go to bed. Now, the snack can always be something healthy. Eat some vegetables, eat some fruit, have some nuts, and or seeds. All these things are healthy. They don't come in a box, they don't come in a can, they're not processed, they don't come out of a window like fast food. So it should always be something healthy for you. Insulin resistance, on the other hand, is a high blood sugar, but it hasn't reached the point of diabetes. Remember, 126 or below is pre-diabetes. So it's called pre-diabetes, and it results in the cells becoming so resistant to insulin that no glucose actually enters the cell anymore. And you need glucose in your cells to make the energy for your body to function properly. It's vital, it's an important part of life's function, and your brain and nervous system need two things to survive. It needs oxygen and it needs glucose. So fuel and activation are the two things it needs. Out of that fuel, it's oxygen and glucose. You see, glucose travels from the blood stream until it's turned into triglycerides for fat storage. That's where we get fat storage from the triglycerides. So that's why it's important to also monitor the triglycerides as well as your glucose levels. The process of going into fat storage demands an increase actually in the amount of energy that's causing the person to feel tired after they're eating. So process of going from fat storage into fat storage for your triglycerides actually demands increased energy. So when a person is eating a high carbohydrate diet filled with white pasta, white breads, refined sugars, they can't keep their blood sugar level stable. And this stabilization of your blood sugar is vital for the Hashimoto or hypothyroid patient. Now, if a patient feels sleepy or they crave sugar after they eat, they know that they've eaten way, way too many high refined carbohydrates. If you feel sleepy after a low or no carbohydrate diet, then most likely you are insulin resistant. So hopefully that kind of balances things out and you understand a little bit more about this sugar. It literally is impossible to support hypoglycemia or insulin resistance unless you're eating healthy. You have to have high protein intake. You need to eat protein in the morning, not carbohydrates. You could eat eggs, you could eat your meat, turkey or chicken sausage, you can eat proteins, but by all means, just don't fill up on all those carbohydrates first thing in the morning. We need to make sure that we support your blood sugar. Even if you feel nauseous first thing in the morning upon waking, eat breakfast with a high protein intake. Most likely, the nausea will subside if you do start eating high protein first thing in the morning. Okay. Finally, if you have hypoglycemia, you should never ever fast. It'll definitely make matters worse from a thyroid standpoint. So don't suffer another minute, another day, or another year. Call our office at 714-730-5833 and schedule your initial consultation. Call now. Space is limited.